Today we are going to discuss an important, interesting case. This is a middle-aged lady who has come from a neighboring area, and she is complaining of a swelling and skin hanging down in the right limb, lower leg as well as the thigh. And she has similar lesions in other parts of the body, on the forearm, over the abdomen, over the upper arm, and in the foot also. This is for the last 6-7 years, and it is progressive. And the only problem with this is that sometimes she says that it becomes huge in size, much bigger than what it is, and sometimes there is infection and there is pus discharge from this particular swelling. He has consulted many physicians and doctors, but she has not got adequate relief, and that is why she has come to our OPD today. In this case, since the first thing we want to know from the patient is it from childhood or not? So, because many lesions like this are congenital in origin, but from the history we know that it is not from childhood. She has had this problem for the last 6 years. The other thing is, are the other family members also affected? Because many times it's a genetic disorder in which there is some change in the genes, which many family members or the siblings are affected. But in the history, we have come to know that no other family member is affected from a similar illness. So it is an isolated, or you can say sporadic case. Now what it is, that is very important. So first we will try to see inspection. On inspection of the right limb, there is some edema, vitals are normal, and there is no bleeding edema in the feet. Mild edema is there. There is no pitting edema in the limb, and this is a soft swelling which is around 25 centimeter vertically and maybe around 35 centimeters transversely, affecting the foot, leg and the thigh. And there are multiple nodular areas in between. The skin is lax and stretched, and there are skin changes on both sides. You can see there are some hemorrhagic areas also. The proximal skin or proximal thigh appears to be normal. On the medial side also, the lesion is just at the similar position and affecting the thigh and the leg. And there is an ulcer also over the one of the areas, and probably this is the site from where the pus was being discharged. So maybe this is a traumatic injury to that area which has resulted in an ulcer formation. Regarding the other area, the left leg is normal except for small similar nodules in multiple places, and there is one big swelling here on the plantar aspect of the foot, extending to the posterior aspect of the heel. On the abdomen also there are multiple similar lesions of various sizes ranging from 1 centimeter to 3 centimeters. Now in the upper arm, there is, on the left side, there is no lesion except one small lesion on the upper arm and also on the dorsum of the hand. Whereas on the right side, there are multiple lesions of various sizes in the upper arm and in the hand also. चलने फिरने में कोई परेशानी तो नहीं होती,
चलने फिरने में ये वो रहता तो गिर पड़ती हूँ।
गिर पड़ती हो इसकी भारीपन की वजह से?
हाँ।
अच्छा, और कोई रुकावट तो नहीं है? तो शी हैज सम डिस्कम्फर्ट बिकॉज ऑफ द हैवीनेस। कभी ये सूज भी जाता है?
हाँ, सूजा नॉर्मल रहता है।
नहीं, बहुत इससे भी ज़्यादा।
एक तो बंद हो जाता है, कट हो जाता है।
हाँ, sometimes she says that the swelling becomes much larger than what it is, and sometimes it gets relaxed. So, and on examination of the abdomen, there is no splenomegaly, there is no hepatomegaly, there is some fullness in the lower abdomen, the umbilicus is everted. Maybe this is also having some lesion similar to this one, so there is umbilical eversion. ठीक है, पीछे पीठ में तो नहीं है? नहीं. So this mainly in the upper arm, right lower limb, thigh, and multiple small areas, not on the face or any other part of the body. Now, palpation, it is soft in consistency at areas and it is continuous with the skin. You see the skin here is pinched and also here the skin is pinched. So it is a part of the skin which is hanging down. Muscles are not involved. Muscles are free, but it is the skin part which is involved in all the areas. So most of the part is free from the muscular tissue. It is mainly skin which is enlarged and hanging down. छूने से महसूस हो रहा है? There is no loss of sensation. She is able to appreciate. छू रहे, छू रहे, छू रहे. So that is very important also to know whether it is a neurological issue in which there is loss of sensation. So now let us come back to the summary of this case. Middle-aged lady presenting with a huge swelling which is affecting the posterior aspect of the thigh and leg, and small multiple swellings in different parts of the body. It is not a congenital swelling, it is not a vascular swelling, it is not since birth, and no other family members are afflicted. So, and there is no past history of fever and chills, and she does not come from a endemic zone. Means once we come to the differential diagnosis, the first thing which comes to my mind is that it is likely to be von Recklinghausen's disease, which is neurofibromatosis, and this is affecting the thigh and the leg and other parts of the body. This is one of the differential diagnosis. The other, since it is in the area of the lower limb and there is some swelling, edema, the other possibility is but this patient does not come from an area where filaria is common, so it is very unlikely. Other than that, we don't think there is any other lymphangioma is another possibility. So if we shortlist the clinical diagnosis, the von Recklinghausen's disease would be the first, lymphangioma would be the second, and the patient belonging to non-endemic zone, filariasis is another possibility. So now what is the plan for this patient? The plan for this patient is that we want to confirm the diagnosis. So for confirmation of the diagnosis, we have to have a tissue biopsy. And we are planning to take a tissue biopsy from the upper lip, and once we get the tissue biopsy, we will be knowing what it is. It's a neurofibroma or lymphangioma or filariasis or some other element, and accordingly we will decide about the management of this case. So that means what management is required is excision of this whole area and Unless and until we are sure about the diagnosis on histopathology, any surgery in this field, there is a high risk of recurrence. In neurofibromatosis also there is a high risk of recurrence. But since she is symptomatic, something needs to be done. One investigation which is needed is, other than histopathology, is MRI. So that will show us which layer of the skin or the muscle or the whole tissue is involved, and hopefully we'll be able to come to the final diagnosis after an MRI and histopathology. So that is our plan for this patient. Thank you very much.